Hi everyone, I'm Jolene Cicchese from TLC Private Home Care in Buzzards Bay. I'm a registered nurse and welcome back to TLC Cares. It's been a summer, a little rainy, a little warm. It's still warm today. It's like 95 out there today in September. I hope everyone enjoyed their summer, and today's topic is going to be diabetes. So what is diabetes? It's a very serious condition that causes higher than normal blood sugar levels. It occurs in your body when your body cannot make or effectively use its own insulin. Insulin is a hormone made by special cells in the pancreas called islets. Insulin serves as a key to open your cells to allow sugar from the food you eat to enter. That is used for energy. So let's think about that. It occurs when your body cannot make or effectively use its own insulin. Insulin is a major hormone made by cells in the pancreas called islets. So if the islets don't work, insulin is the one that's going to have to come on board. So there are two types of diabetes. There's type 1. Type 1, formerly known as juvenile diabetes, mostly because it happened in kids, but now it's happening to more and more people. About 5% of the people who do have diabetes have type 1. In type 1, the body's immune system attacks the islet cells in the pancreas. So think of the immune system in your body as the little army. The little army is, the immune system is very important in your body. It helps fight all kinds of diseases and infections. But once the insulin producing cells are destroyed, a person can no longer produce insulin. Without insulin, which is the key, sugar can build up in the bloodstream. And the body's cells starve, and that becomes dangerous, and type 1 is needed to be treated with daily insulin. So then there's the type 2, also known as adult onset diabetes. It's the most common. There's many risk factors, we'll go into that later, about what can cause diabetes. It's just as serious when blood sugar levels go up and down, it's extremely serious. So type 2 happens when people can produce some of their own insulin, but not all of it. And sometimes the insulin will try to be the key to open the door to allow it to the cells to enter, but it doesn't always work when you want it to. So this leads to insulin resistance, and it's treated with oral medications. And if it gets severe, it's then treated with insulin. So warning signs of diabetes. There are many, but if you have type 1, you already know by now, I'm sure. But the warning signs for type 2 are increased thirst. Did you ever have that cotton mouth feeling in your mouth when you get a little white on the sides over on your lips? Well, increased thirst can produce that. So increased urination, if you start to find that you're going double the amount that you normally do, maybe you have a urinary tract infection, but maybe it could be a symptom of diabetes. Rapid weight loss. Rapid weight loss, why would that happen? It's because the blood sugar builds up in the blood. So the body needs something for energy, so it attacks the fat in the muscle, which can cause rapid weight loss. Extreme hunger. You're ravished. You can't seem to eat enough in order to satisfy your body. Extreme weakness. When your body is attacking your muscle, you will get extremely weak because you need your muscles for mobility, for every little thing you do. Might get irritable. Irritability is a big one for type 2 diabetes. Blurry vision. Blurry vision is significant because sometimes type 2 diabetes or even type 1 can cause eye issues. Another warning sign is nausea, vomiting, and abdominal pain. And sometimes, not all, but sometimes there might be an unpleasant breath odor. So let's talk about how to lower your risk. Lowering your risk. If you can get to a healthy weight, losing 7 to 10% of your current weight cuts type 2 diabetes in half. Let's say that again. Losing 7 to 10% of your current weight cuts type 2 diabetes in half. If you're already at a good weight, you don't really have to cut 7 to 10% of your body weight. This is for on the verge of obesity and obesity, belly fat. We want you to, how to lower your risk? We want you to eat healthy. We want you to exercise. A sedentary lifestyle is a risk. Maybe you could aim for 30 minutes a day. Walk the dog in the morning for 30 minutes, or go for a brisk walk in the evening when the weather cools down a little bit. Try and do something every single day. You could even clean the house for 30 minutes at one time daily, and that would take care of some activities. There's many things you can do while you're sitting down or standing in your house. You can march in place, you can do leg lifts, you could just move your body. Stop smoking, that's a big one. Smokers are 2 times likely to get diabetes. So definitely stop smoking. There's many other health risks that involve smoking, as I'm sure you know with respiratory illnesses. Reduce your stress. Stress plays a huge part in the body and the belly fat, and you want to try and just take deep breaths and relax. Don't let things get you upset. Count to 5 and then, answer your person that's maybe you're getting upset with. Just take a deep breath and count to 5. Control your blood pressure and your cholesterol levels. If you have blood pressure issues and you're on blood pressure medications and it's controllable, that's wonderful. Make sure your cholesterol is under control as well. So if you're taking a statin, you might want to take a look at how you can lower your nutrition from that as well. You can look it up online, or cholesterol is can build up in the bloodstream, and it is related to red meat, fat, sugars, high fruit drinks, things like that. So we want to replace refined carbs with whole grains. I'm sure you know what your carbs are. A lot of people talk about their carbs. Carbs are white bread, white pasta, things that pretty much taste good. You don't want to have any white rice and breakfast cereal. Choose smart. If you're going to have a breakfast cereal, have something with a bran in it. Replace all your whites with whole grains. So instead of white pasta, let's try whole wheat pasta. Instead of white rice, let's go to brown rice. Try for a little bit of a difference. Barley, quinoa, those are also good for you. And if you're going to grab the cereal in the morning, make it bran flakes. You want to replace all your sugary drinks with water, coffee, or tea. I would say prune juice is good for many of our elderly because it helps increase your bowel activity. And you don't want to give that up. And you don't want to give up cranberry juice if you're trying to prevent a UTI. But having a Coca-Cola or any other kind of soda, it's just not necessary. Have water, have coffee, have tea. Choose the foods that are lower in calories and higher in fiber. Fiber also helps motility, moving those bowels along, so you'll feel even better. So if you know of someone who has diabetes, our agency, TLC Private Home Care, has a diabetic management program. And in this program, it's run by the nurses. And if someone cannot do their insulin, cannot dial up their pen because they cannot see, or cannot draw up their insulin because they can't see, or don't have the dexterity, or do not may have Alzheimer's or dementia, we can help. We can go in daily, we can do their daily blood sugar draw, their daily insulin, we can have contact with the physician, we can email them all the results. If there's a high sugar or a low sugar, we will report it to your physician and your family. We have this program that we're able to do this every single day. It's a diabetic management program, and it's fantastic. And when you have a nurse on your side and in your corner, keeping an eye on you every single day, whether you're at home or in an assisted living, it can be really helpful. So I just wanted to talk today about diabetes. It's my first show back after the summer, and hopefully everyone's summer went well. Mine did. And my name is Jolene Cicchese. I know it's a hard last name, Cicchese, and this is TLC Cares. Until next time, have a great rest of your week.